Welcome back to ECGenius. In today's lesson, we'll be talking about heart block. You should consider looking into the possibility of heart block in any patients who presents with a slow heart rate or bradycardia. Let's start off by quickly reviewing the PR interval. The PR interval is considered to be from the beginning of the P wave to the beginning of the QRS complex. A normal PR interval ranges anywhere from 120 to 200 milliseconds, or 3 to 5 small boxes on an EKG strip. Now let's dive into our first example here. The first question we want to ask when we're considering potential heart block is, does every P have its own QRS complex? In this case, we have a P wave here, followed by QRS, P wave here, QRS, P wave, QRS. So in this strip, every P wave does have its own QRS complex. Now the next question we want to ask is, what is the PR interval, or how many boxes? So let's look at this one here. We have 1, 2, 3, 4 small boxes, which would give us a normal PR interval. So is the interval prolonged? In this case, it's not, and this is actually a normal EKG. Moving on to our next example, let's go through the same questions. Does every P wave have its own QRS complex? P wave QRS, P wave QRS, P wave QRS. So yes. Now let's look at the PR interval. In this case, it ends up being 7 boxes, which would be considered a prolonged interval. So this here is an example of a first-degree heart block. In first-degree heart block, the PR interval is longer than 200 milliseconds, but you still have a QRS complex following each of the P waves, and the PR interval remains largely unchanged. Okay, how about this one? Does every P have a QRS complex? P wave QRS, P wave QRS, P wave QRS, P wave, no QRS, P wave QRS. So no. And if we look closely at the PR interval, here's our first one, here's the second, here's the third, and then we get a dropped beat. So what we have here is this progressive prolongation of the PR interval until we get a dropped beat. And this is the Wenckebach type of heart block, or Mobitz 1. Moving on. Starting off, does every P have a QRS? P wave QRS, P wave no QRS, P wave no QRS, P wave QRS. So again, we don't have a QRS complex for every P wave. If we look, we have 1, 2, 3 P waves for every single QRS complex. And the QRS complex is still tied pretty closely to the P wave that comes before it. So this is an example of a Mobitz type 2 second-degree heart block. These can vary depending on how many P waves you have for each QRS complex. So you could have a 2-to-1 or a 3-to-1, for example. Now let's look at this EKG. Does every P have a QRS? Let's see. P wave, P wave, QRS, P wave, no QRS, P wave here. So every P wave does not seem to have its own QRS complex. And if we look, the intervals between the P waves are pretty much identical and don't change. And then the QRS complexes also seem to have the same intervals between them. So this is a perfect example of third degree or complete heart block, where we have the P waves from the sinoatrial node going off at their own rate. Then you have complete disconnection with the ventricles, and then you have a ventricular QRS complex beat going off at its own separate rate, and the two are completely desynchronized. Now I'd like to give 2 mnemonics you could possibly use to help remember the different degrees and types of heart block. The first one is a poem, If the R is far from P, then you have first degree. Longer, longer, longer drop, then you have Wenckebach. If some P's don't get through, then you have Mobitz 2. If the P's and Q's don't agree, then you have third degree. And here's another memory tool you can possibly use to help keep track of the different types of heart block. In a normal EKG, the husband, the QRS complex in this case, comes home on time every single day from work. In a first degree heart block, on the other hand, the husband starts to come home about an hour late every single day. So he still comes home, but every day he's late. In a second degree Wenckebach type of heart block, the husband starts to come home just a little bit later every single day. So first day he comes home at 5, and then at 6, and then at 7, and at some point he just doesn't come home at all. And that's where you have your dropped beat. In a Mobitz 2 type of heart block, the husband just doesn't come home at all, randomly, every couple of days. And finally, in a third degree heart block, the husband and wife are divorced, and they live completely independently, so the QRS complexes and the P waves are going off at their own rates and doing their own business completely separately from each other. And with that, we complete our review of heart block.